Hello, my name is Chad Kodiak. I am a pharmacist and the owner of Kodo Care Pharmacy. I'm here to talk to you about the COVID-19 vaccine booster, and specifically the question we've been getting a lot lately about the fourth dose. So let's take a look. When we think about COVID-19, we think about vaccines, there's a lot of recommendations that have been changing, and we want to know, how do we make sure that people are up to date on the current vaccines that they need? And so before we start, I have a couple of quick disclaimers. First of all, this information is for educational purposes only. If you have specific questions about an individual patient, an individual situation, please talk to a pharmacist or another healthcare professional to find out about that situation. Also, all of this information is current as of February 8th, 2022, and as we know, is subject to change. Now, let's take a look at what it means to be up to date on the COVID-19 vaccine. Take note, I said up to date. So the CDC here at Kodo Care Pharmacy and across the healthcare continuum, we are changing our terminology away from fully vaccinated back to the term we've used forever, which is up to date. So if someone's up to date on their vaccine, what does that mean? Well, what it means is they've completed their primary series first. So what is a primary series? Well, for COVID-19, primary series, if they received the J&J vaccine, it is a single dose. If they've received either of the mRNA vaccines, either Pfizer or Moderna, it would be 2 doses if they're immunocompetent. Immunocompetent meaning they are not immunocompromised. If they're immunocompromised, they need 3 doses of the mRNA vaccine. Immunocompromised can be someone who has an immunocompromised diagnosis, a condition, or if they're taking an immunosuppressive therapy, if they're taking a drug or a medication that suppresses their immune response. So this is what's considered the primary series. No matter how the primary series is completed, a booster dose is currently recommended 5 months after completion of that primary series. So you've heard about a 4th dose. We've been asked about a 4th dose. This is where that's coming from. It is not a 4th dose, right? It is 3 doses for an immunocompromised patient with a booster 5 months later. Let's use an example. We have a patient who has an immunocompromised condition, immunocompromised diagnosis, okay? Somebody with HIV, somebody taking a steroid long-term, right? They are considered immunocompromised, right? They have a cancer diagnosis, they're immunocompromised. They're gonna get 3 doses of the mRNA vaccine. Then 5 months after completing that primary series, they're going to receive their booster. So this is what the current recommendation is. There's many scenarios. There's a lot of question of what is immunocompromised, what it counts as immunocompromised, and that is something that we can help with. So if someone's not sure, if they don't know what to get or when to get it, they can talk to any of our pharmacists to find out why. So that's our tidbit for today. Thank you so much for tuning in. Once again, I am Chad Kodiak from Kodo Care Pharmacy. Have a great day.